Hello everyone and welcome to another video, and in this video I'm going to tell you about top 5 lucrative nursing careers. The medical industry's lifeblood is its nurses, and we can never have enough of them. Nurses fill in the gaps wherever assistance is required, whether it be providing care for ill patients, planning treatments, supporting doctors, delivering infants, or aiding with medical procedures. The Bureau of Labor Statistics predicts a 9% employment increase in the nursing industry over the next several years as demand for nurses rises throughout the country. Additionally, they predict that there will be about 200,000 vacancies for registered nurses each year until 2030. The country will need to fill all of those posts in order to prevent a nursing shortage. In other words, nurses are not only valued but also in great demand. However, nursing positions are not all created equal. The list of nursing occupations and classifications includes a wide variety of specializations, each with its own duties, market demand, and salary range. Have you ever wondered, though, what the top paid nurse position is? We've produced a list of the highest paying nursing positions in 2022 together with each position's qualifications, expectations, and employment forecast to assist existing and prospective nurses in finding the position that's the greatest match for them. Here are some salary data for the best paying sectors, states, and locations for nurses before we get into the highest paying nursing positions. Here's a list of top 5 lucrative nursing careers. Number 5, critical care nurse. The patients whose lives are in danger get the most of the time and attention from these highly skilled and well-equipped specialists. These are the patients who are on the verge of passing away based on a single choice or deed. As a result, becoming a critical care nurse, often referred to as an ICU nurse, calls for steely nerves, in-depth pathology knowledge, and quick and precise decision-making abilities. All nurses must have a high degree of organization, but critical care nurses especially need it. Patient care requires a thorough and intensely observant approach, and CCNs collaborate closely with the critical care team to provide the best results for their wards. The average salary for these nurses is about $118,000. However, the 90th percentile of nurse practitioners might earn up to $163,000 annually on average. Number 4, general nurse practitioner. Being a general nurse practitioner, GNP, has several advantages, one of which is the ability to work independently, i.e., without being directly supervised by a physician. These nurses may also work in a private practice and specialize in certain fields of medicine, like pediatrics or dermatology. With GNP patients expressing greater overall satisfaction and fewer hospitalizations than patients under a doctor's care, general nurse practitioners often earn good marks for their performance. Healthcare provided by a general nurse practitioner is often less expensive than medical treatment provided by a doctor. It shouldn't be a surprise to hear that general nurse practitioners are among the highest paid nursing professions in our country based on some of the facts presented here. General nurse practitioners earn an average salary of $118,000 per year, or $57 per hour, according to the BLS. In the top 10% of pay ranges, nurse practitioners may earn more than $163,000 annually. Number 3, neonatal intensive care nurse. The most vulnerable patients in the hospital are infants, who are cared for by an NICU nurse, also known as a neonatal intensive care nurse. NICU nurses also provide medically challenged care for patients up to 1 or 2 years old in addition to looking after and monitoring preterm newborns. When discussing treatment and diagnosis with worried parents, this highly specialized sector need outstanding communication skills as well as a great lot of courage and compassion. It's difficult labor, but it's also one of the nursing occupations with the greatest compensation. The typical NICU nurse salary, according to ZipRecruiter, is over $120,000 per year, or $58 per hour. The highest paid NICUs may make up to $240,000 a year. Number 2, nursing administrator. Consider the nursing administrator, NA, as the signal that maintains the healthcare industry's pounding heart, the nurses' beating. The management of the nursing personnel is within the purview of nursing administrators. They are also in charge of resource allocation, scheduling, and a host of other nursing duties that are vital to the efficient running of a hospital or clinic. A thorough awareness of a nurse's duties and expertise in medical office management are prerequisites for this position. Nurse administrators play a crucial role among the hospital personnel and their patients since their position reflects the ideal balance between those two worlds. On our list of nursing specializations, it is also one of the top paying ones. Nursing administrators earn an average salary of roughly $120,000 per year, or $58 per hour, according to the BLS. The top 10th percentile of nursing administrators may earn up to $206,000 annually. Number 1. Certified Registered Nurse Anesthetist. Millions of surgical, obstetric, and trauma patients get anesthetics every year from Certified Registered Nurse Anesthetists, CRNAs. Since the Civil War battlefields were where nurses first started giving anesthetics, they have been in charge of this duty for a very long time. Know of the procedure. Nurse anesthetists work alongside surgeons and anesthesiologists in all medical specialties, whether it's open heart surgery, a root canal, or childbirth. The Certified Registered Nurse Anesthetist, CRNA, is the highest paid nurse on our list since they offer anesthesia alone in many rural hospitals. Certified Registered Nurse Anesthetists earn an average salary of nearly $202,000 per year, or $97 per hour, according to the BLS. Salary ranges for nurse anesthetists in the top 10% may be as high as $254,000 or more. And with that, everyone, I hope you enjoyed the video. If you did, please like it and, if you haven't already, subscribe to our YouTube channel.